It was one of Arnold Moriwau's assistants who first saved his life by noticing his eyes looked yellow. Recognizing jaundice, Moriwau went to his doctor and eventually was diagnosed with pancreatic cancer. However, an experimental treatment developed in the laboratory at the University of Michigan Comprehensive Cancer Center gave Moriwau the hope that he could beat one of the most deadly types of cancer.
Approximately 29,000 patients a year in the United States will get this disease, and all but a very small fraction will die of it. So if you look at the number, it's about 29,000 a year of cases, and you look at the number of deaths, it's about 28,500. It's the fifth most common cancer killer in the United States.
I was diagnosed as having pancreatic cancer. It was in the head of the pancreas. And they told me that I had a tumor of between 2 and 3 centimeters that was pushing on the bile duct, and that was the reason that I was getting jaundiced. The first thing I thought of is, I don't know of anybody that survived this. And so there was a great deal of fear. But then I sort of calmed down, and Gail and I, my wife, went on the net, and we pulled up all the documents we could. And we printed them out, and we spent a weekend, and we read really over 100 different papers. And we saw there was a chance. And so we said, okay, the survival rate's 4%. We're going to be one of those.
Those who can have it removed surgically, and there's a real chance of cure, although it's still only in the range of about 20%. That group only represents about 1/6 of patients. So 1/6 of patients have removable cancer, and only about 1/5 of those patients are cured. So if you're following me, that's about 1/30 of all patients are curable. Our research has been focused chiefly on patients who have disease that's localized to the pancreas and not removable, but has not spread to other parts of the body. And that represents about 40% of patients who have pancreas cancer. So the strategy that we've used that's unique is to intensify the therapy that will go throughout the body while maximizing the intensity of the treatment to the tumor that we know about, to the primary pancreatic tumor. So this is done by intensifying the chemotherapy cocktail using gemcitabine and other medications while using very targeted and sophisticated radiation techniques to limit the dose just to the tumor. In addition to prolonging the average survival of patients, our more refined approaches are making some tumors that used to not be removable, removable. And now as many as 1 patient in 5 whose tumor used to be considered absolutely unremovable can now be removed. This is actually a very exciting time in the treatment of pancreatic cancer. In the past, pancreas cancer was a death sentence. And I would say even as recently as 5 years ago, if someone had a diagnosis of pancreas cancer that couldn't be removed, many physicians would recommend that they seek only care of their symptoms and not even undertake anti-cancer treatment. The recent developments, many of which I think we've contributed to, particularly using intensified chemotherapy with radiation, have now made pancreatic cancer still a serious disease, but a hopeful disease. And in fact, a disease in which we can hope for cure in patients who previously had no chance for cure.
I am 6.5 years out of treatment, and I'm doing just great. I do everything I want to do. I'm an avid golfer. I play golf. We are traveling. We just got back from Alaska. The treatment had no effect at all on my life, other than impressing me with the quality of care I received. The cancer was an eye-opener. I enjoy things more. Everything's much more precious to me. Life is precious.